After clearing cervical nodes, we will clear axillary nodes before clearing the chest and the arm area. To clear axillary nodes, we will abduct our client's arm to 90 degrees. We will support it at their arm or at their tricep, and their forearm will be passing between our hip or oblique area and our arm and forearm. So the client is relaxed, so we are supporting their arm. We don't want them to tense. And we will place our fingertips in the axillary area, somewhere in between the pec major and lats, right? So comfortably closer or a little bit further from the shoulder joints. And we'll be performing stationary circles directed medially and superiorly towards the axilla. So it is actively doing semicircle medially superiorly, and we let the skin spring back 5 to 8 times. And we bring back their arm to neutral. In order to clear the chest area, we will drape it with additional small towel. What we will do, we will make a V letter from an additional small towel in a way that both ends of the towel are on client's shoulders. So that particularly will be important for women. However, we want to drape men's chest as well. And so we will hold the draping, and we will gently remove the underneath towel. We need access to the ribcage, to end of the ribcage, so the towel can be comfortably sitting on the lower abdomen, and we need access to the chest. First stroke is sweeping stroke, and we'll be sweeping with our thenar eminences, starting below the clavicles and on sternum, and we will be sweeping to the sides from sternum to the axilla area. 5 to 8 strokes. Second stroke is very similar. We can use our thenar eminences or full hands, and we'll be sweeping underneath the breast area from the midline towards hooking the fingers towards the axillary area. So starting at underneath the breast tissue, and we'll be sweeping towards the axilla. So I'm using my thenar eminences to sweep. You could also focus on your fingers, so this way. Five to 8 strokes. Next stroke is combining those two first strokes. So we will be sweeping with a relaxed hand from the sternum to the axilla area, and from and underneath the breast, from midline to axillary. So alternating hands. One is sweeping over the chest just under the clavicle, the other one underneath the breast tissue from the midline towards axilla. 5 to 8 strokes alternating. Then I will change my position and I'll do it the same on the other side. After that, we will place our fingertips of both hands on the lateral aspect of the rib cage, just underneath the shoulder. And our thumbs could be sort of interlaced together, and we will be performing stationary strokes directed towards the axilla. We'll be sweeping medially superiorly and let the skin spring back. Medially superiorly, let the skin spring back. So we do it first with both hands at a time, 5 to 8 strokes. And then we do it with separate hands. So first will be my upper hand, so doing medial superior stroke, and then my lower hand. So looks like this, 5 to 8 stationary circles. After that, I will change my position and I will do exactly the same on the other side. Later, we will repeat our alternating sweeping strokes. And we will finish off with the same 2 strokes that we started. So one will be with thinner eminences, we'll be sweeping the chest area. Five to 8 strokes, and then we go and sweep from the lower rib cage area, from the midline towards axilla. Then we will cover the chest and we will gently remove the towel.